Dr. Samdani, the concern for a lot of parents is that COVID is now affecting children, something which was not there in the first wave. Is this the differentiating factor about the second wave?
So yes, as a matter of fact, COVID is affecting the kids more. But do realize, Nikunj, when we had the first wave, we were in a complete lockdown, number one. So all the kids and everyone were at home and their mobilities were extremely restricted. Now, this is coming as a double mutant strain, which is London, Brazil, and South African strain, which supposedly is affecting the kids more.
Protocols which essentially have to be followed for children who are getting affected because of COVID, because for adults we know what's the procedure and what is the what are the medicines which need to be administered.
So for kids, what's happening is we've got a rise in the numbers because we've got play dates, we've got little toddler mother programs. They're socializing in their building, on their playground. They're meeting other friends. So the COVID appropriate behavior for the kids have been extremely lax. And interestingly, what we have observed is that every child that turns out to be COVID positive, there's an adult at home that is positive. So whether it's the child that's transmitting the infection to the adults or the adults are silent and they're asymptomatic carriers and affecting to the kids, nobody really knows. But yes, to my understanding and to our experience, that every child that's infected, there are at least 2 or 3 adults at home which are infected. And the protocol remains the same. The child would have, what we've seen is, the beauty is that the cases are very mild, Nikunj. So there's fever 9900, which lasts for 24 to 36 hours. So there's no real panic story. We treat with paracetamol and 99% of them in the next 24 to 36 hours are settled without fever and then they're fine.
Are you getting cases where the child or children in this case, they also have to be hospitalized? Have you seen cases dropping to such levels?
So as of now, in this wave, no. But in the last wave, I had a child that was 45 days old, which was hospitalized, but came out safely, required supportive care with oxygen, IV maintenance, and supportive medications and came out well. But as of now, in this wave, all the kids that I've seen are doing well at home.
We pretty much know the protocol what an adult has to follow, which is keep on checking your saturation level, keep on monitoring your blood pressure and your temperature, and if temperature goes above a threshold and oxygen goes below a threshold, you must get in touch with the doctor. What are the necessary protocols which a parent needs to administer if a child gets COVID?
So at the moment, we measure the temperature. Anything more than 99, you need to give paracetamol and keep it every 6 hours. Now, the problem is with infants, toddlers, and small kids until 5 years, taking saturations is not really easy because their thumb doesn't come into the infrared light that it can be picked up well. But if there are no supporting complaints, as in respiratory problems, if there's no much cough, then I think paracetamol just needs to be there. Look at the range of fever. Look if there's rash, if there's diarrhea, there's redness of eyes, or if there's nausea, vomiting, pain in abdomen, just inform the doctor.
Dr. Samdani, my 9-year-old, every time I tell him not to go down and play, he says, I want to watch more TV or play more video games. What am I supposed to tell him as a father?
Nikunj, this is like a catch-22. I think you should try and play with him. You can probably, if your building has an tennis or a badminton or a table tennis which is there, you should try and play with him. But try and convince him, or with a pinch of salt, he can do online classes and study.